We are going to discuss about congestive heart failure. So heart failure is happen due to if there is increase in demand of the body, or there is a decrease in cardiac output. So there are two conditions by which your heart can fail. If your body demand is too much and your cardiac output is unable to meet that demand, due to that heart failure can happen. Another condition is when your cardiac output is not maintained due to XYZ reason. We will discuss what are the reasons by which your cardiac output will be decreased. So I hope every one of you knows how heart works. Heart have 4 chambers: left atrium, left ventricles, right atrium, right ventricles. And heart is just act like a pump, right? It pump the blood. Left ventricle pump the blood to the aorta, aorta to arteries, then arteries to capillaries, and through in capillaries there is an exchange of nutrient or oxygens to the cells. So your oxygen and nutrient centers, and these oxygen, in the presence of oxygens, your oxidative phosphorylation, Krebs cycles, these all processes will happen, and during that processes your ATP is released, and ATP will degrade into ADP plus phosphate, and during this process energy is released, and that energy is utilized by the body. So during these exchange, oxygen is entered and carbon dioxide is released, and your waste material is also released into the blood, and this blood we call deoxygenated blood. And the blood which is pumped by the left ventricle to aorta, then arteries, then capillaries, that blood contains more amount of oxygen. So oxygenated blood doesn't mean it contains 100% oxygen. It has a maximum oxygen but less percentage of carbon dioxide as well. So in this case also, now when this exchange happens, so this blood contains carbon dioxide more, and waste material is also there, that we call deoxygenated blood. So mainly veins carry the deoxygenated blood, and these we call arteries. So this blood will enter, go back to the right atrium, and these atrium, between these ventricle and atrium there is a valve. Left atrium, left ventricle's valve is bicuspid valve, and there is a tricuspid valve. So this right atrium blood will enter into the right ventricles, and right ventricle will push the blood to pulmonary arteries. So pulmonary arteries contains the deoxygenated blood. Rest of the arteries in the body always carry the oxygenated blood. So it goes to the lungs. Means in the lungs there is an exchange of what? Exchange of carbon dioxides go outside and oxygen will go inside, right? So this will enters like that. This is your cycles, how blood is circulated or how the blood is pumped throughout the body. So again, heart has a 4 chamber: right atrium, right ventricle, left atrium, left ventricles. So this ventricle will contract, left ventricle will contract and push the blood to the aorta, aorta to arteries, arteries to capillaries, and it contains oxygen more. And this reach, and there is a tissue exchange. This oxygen will reach to the cells, and metabolic processes will take place, and these carbon dioxide will be released out, and it enters into the right atrium, and during the depolarizations, this right atrium will contract and push the blood to the right ventricle. Right ventricle's blood will go to the pulmonaries and contains the oxygen. So this is your cycle. So what is a CHF? Congestive heart failure can happen. As I said, two conditions is there: either increasing the demand of the body, or either there is a decreased cardiac output. So demand of the body can be increased in particular conditions. Like one of the conditions where demand of the body is increased, that condition is thyrotoxicosis. Thyrotoxicosis, in which demand of the body is increased and your normal cardiac output is unable to meet that demand. There is another condition we call beriberi. There is severe types of anemia. In anemia also there is a increase in demand. Beriberi, anemia and thyrotoxicosis are the some of the conditions in which your demand of the body is increased and your normal cardiac output is unable to meet that demand. So that we call congestive, that could result in the heart failure, right? Now another failure can be happen to decrease in the cardiac output. So when this cardiac output, particularly cardiac output can be decreased from the right side, can be decreased from left side. But if you see the cases of CHF, more cases of left ventricular failure as compared to right ventricular failure. So these left ventricles, when unable to push proper amount of the blood to the aorta or arteries, due to that your left ventricles your heart can be fail. So now question is, what are the conditions how this left ventricle is unable to push the proper amount of the blood to the aorta and artery? So there are there can be intrinsic factors, there can be extrinsic factors. Intrinsic factors means there is a intrinsic problems in the left ventricles. Maybe left ventricles there is inflammation is happen, like myocarditis, there is any disease, there is a ischemia in particular region. Suppose there is a ischemia it happens. Ischemia is loss of blood supply to particular part of the myocardium. So due to that one, what will happens, your cardiac output will not maintain, because there is an intrinsic problem in the pump. Your pump has a problem, right? So if your pump is not functioning properly, so that could result in decreased cardiac output. So your cardiac output will be decreased. That is the intrinsic factors. Then second factor is the there is a two concepts when we talk about heart failure is preload and afterload. So that comes under your extrinsic factors. So if in preload is increased, that could also result in heart failure. If afterload is increased or both will be increased, these both could result in the heart failure. So what is preload and afterload? So preload is a conditions, as so word indicate what is preload and afterload. So preload, as its name indicates, it's a load, right? Load on where? Load on heart. So load on the heart or load on the ventricle. Who is creating that load? Load is creating by the blood. Load on the ventricle created by the blood during diastole. So diasystoles, your heart is relaxing, right? So your heart is relaxing. During that time, the blood, the load created by the blood in the ventricles during the diastole, during the relaxation, that load we call preload, right? So if this preload is increased much more, so that could result in heart failure. I will explain you. If little bit increase in preload, your cardiac output will increase, but at initial stages. But after, if your preload is again excess of preload, result in heart failure, right? Because pump has also a capacity to pump. Like for example, pump has capacity to pump only 130 ml, maximum 130 ml blood. So if you are going to increase the volume, so it could result in pump failure. So that is preload. Then second is afterload. Afterload is a conditions, again it's a load, but in this case load is on contracting ventricles. When your ventricles are contracting, not relaxing. In this case, preload is the load on the ventricle created by the blood during relaxation of the heart, during the diastole. But in this case, load on the heart, load on the contracting ventricles due to resistance in the arteries. So if there is a resistance in the artery, resistance can be happen due to, so there is a atherosclerosis, there is a deposition of atheroma. So that could result in the afterload. So it's a load on the contracting. When your ventricles is trying to contract, but due to these obstructions, it do the back pressures. It will create the load on the heart, and that could also result in the heart failure. Got it? So that is the preload and afterload. You have to clarify on that. And these two comes under extrinsic factors. So as I told you, heart failure can be happens due to intrinsic factors and extrinsic factor. Intrinsic factor is there is an intrinsic problem in the pump. Your heart is not, they are suffering from some disease. There is a ischemia. There is myocarditis. Due to that, your pump is unable to pump push the proper amount of the blood to the aorta, and that volume we call stroke volume. What is stroke volume? Stroke volume is volume of the blood ejected by the ventricles. Right? These all contraction and relaxations happens due to action potential. There is action potential, there is SA node, there is a AV node, there is a Purkinje's fibers, right? So you know there is a resting membrane potential. Resting membrane potential of the cardiac cell is minus 90 millivolt, right? Minus 90 millivolt. This is the resting membrane potential of cardiac cells. So these action potential can go towards the positive side or goes towards the negative side depending upon the movement of ions across the cells. So if your positive ions moves like sodium ions, that will take the action potential towards the positive sides, and that concept we call depolarizations. If you are getting more negative, that concept we call hyperpolarizations. So in this case, how the signal will be generated, how ventricles will contract, there is a movement of sodium ions. Sodium ion movement will result in the movement of calcium, and that calcium will result in the contraction of ventricles, and then your ventricle will contract and push the blood to the aorta and arteries. So now this heart failures is how it's happening. Now we are going to understand what is the compensatory mechanism when your cardiac output is decreased. So up to now we understood that congestive heart failure is a condition in which your ventricle is unable to push proper amount of the blood to the aorta or arteries, or unable to meet the body requirements. So when your cardiac output is decreased, this is a cardiac output. So when your cardiac output is decreased, so what will happen? There is a body, there blood vessels, they have a receptors, and that receptors we call baroreceptors. Baroreceptors are there who will sense that in your body cardiac output is decreased. There is a carotid sinus as well who will sense that your cardiac output is decreased, and by sensing that their cardiac output is decreased, that will lead to the signal to the brain. It will send the signal to the brain, and in response to decrease in the cardiac output, what the brain will do? Brain will do the activations of your sympathetic system. Sympathetic systems. So sympathetic systems will be stimulated or activated, and during the stimulations or activation of sympathetic systems, there is a release of adrenaline and non-adrenaline, right? So adrenaline and non-adrenaline, we already discussed, have a receptors on all over the body. And these receptors are of two types, alpha and beta, right? Alpha is further categorized into alpha 1, alpha 2. Beta is further categorized into beta 1, beta 2 and beta 3. So these adrenaline, non-adrenalines which result in release due to activation of sympathetic systems are non-specific in nature. What does mean the non-specific means? They are not going only bind with alpha 1. They are going to bind with all the adrenergic receptors, and these are the adrenergic receptors. So they are non-selective in nature. So I told you earlier as well, alpha 1 receptors are present on blood vessels. Small blood vessels have a alpha 1. So when your adrenaline, non-adrenaline will act on alpha 1 receptor, it will result in vasoconstrictions. If your vasoconstriction happens, so it could result in increase in blood pressure. That is one of the compensatory mechanism. There is a beta 1 receptors are present on your heart, all over the heart. So beta 1 receptors on the SA node will result in tachycardia. Beta 1 receptor which is present on ventricle, it will result in positive chronotropic effect. Positive chronotropic effect means it will increase the force of contraction of the ventricles, right? So that you want, because what happens in the CHF, your cardiac output is decreased. So you want something who will increase the cardiac output, right? So by these mechanisms, compensatory mechanisms, your cardiac output will be increased little bit, right? There is a other mechanism as well which is going to, because cardiac output is decreased, so your renal blood flow is also going to decrease. So if your renal blood flow is decreased, there is a release of hormone renin. So renin will enter into the blood, and many times we have discussed renin already. So renin, there is angiotensinogen proteins in the blood plasma which is synthesized by the liver. So in the presence of renin, that angiotensinogen will convert into angiotensin 1, and angiotensin 1 will convert into angiotensin 2 through the angiotensin converting enzyme. That angiotensin 2 have a receptors on the blood vessels. That angiotensin 2 act on the blood vessels and result in vasoconstrictions. Angiotensin 2 will also stimulate your sympathetic systems, and stimulation of sympathetic system will again result in increase in cardiac output. Simultaneously, their angiotensin 2 will also stimulate the adrenal cortex, and adrenal cortex will result in release of aldosterone. Aldosterone hormones will act on your proximal tubule of the kidney and do the reabsorption of sodium and water. So this is all the compensatory mechanism which body is trying to maintain your cardiac output, which is decreased in the heart failure. But long run, initially it's good for the for the compensatory mechanism. If you are increasing this cardiac output, so what will happen? This is your end diastolic volume, this is your cardiac output for them. So if you are increasing the end diastolic volume by any mechanism, so your cardiac output will be increased at initial phases, right? But when you are increasing these compensatory mechanism will result in accumulations of more reabsorption of sodium and water. So what will happen? Your preload will increase, because your volume which is in the ventricles during the systole, because what kidney is doing the reabsorption of sodium and water, right? So that sodium and water will increase the load on the heart. Initial stages, when you are increasing the preload, then cardiac output will be increased, but at certain level. How cardiac output is increased? For example, this ventricle have a 130 ml blood, right? At normal physiological stage, your cardiac output is dropped. Cardiac output is, your stroke volume is 70 ml, right? If it's dropped, for example 60 ml, then it will be sensed, and due to compensatory mechanism, how this 60 will become again 70, this preload will be increased. How it will be increased? By the compensatory mechanism. So initially you are increasing the volume, your ventricle muscles will be stretching, right? There is a tension is increased, so if they are stretching, your cardiac output will be increased, right? But that law we call Frank-Starling law. Frank-Starling law. So what is Frank-Starling law? Frank-Starling law states that within physiological limit, if you are increasing the volume in the ventricle, it will result in increase in cardiac output. But within physiological limit, within limit. When your cardiac output, long run, why compensatory mechanism in long run is harmful to the body? Short run, it's beneficial, but long run, what will happen? In long run, you are increasing the preload continuously, and your heart is unable to push the proper amount of the blood to the aorta and arteries. There is a, for example, there is a atheroma is also there. So it will create a problems, and it will result in more worse the case. So if you see the medications which we are using for the management of CHF, we are also using the medications which suppress our compensatory mechanism for the long run, because at long run it will produce the harmful effect. So how it's happening? As I told you, in CHF, if you see with simple explanations, right? I told already as well, there is, for example, worker, and this worker is your, this is one worker, and we consider it as a heart, right? It's a heart. What the worker is doing, it's taking, for example, one particular packet of cement, and he is going to up to this and reach here and expel it out, right? So that is your heart. Heart is taking the load. This is your load, the volume of the blood which is in the ventricles. During this, when your heart is contracting, it's pushing this blood like 70 ml to the aorta and arteries. This is normal mechanism. By this one, your worker is going in 1 minute, is going to how many times? Around 72 beats per minute, right? Or you can consider 60 to 100 beats per minute, right? So that is its time to go and push this load outside, and that is your stroke volume. This is your stroke volume, okay? Stroke volume. Now what happens in the heart failure? Now if, for example, this is your worker, now what you have done? You have increased the load on him or her. You have increased, initially it's taking only one cement packet, now he is taking 2 cement packet. So you are increasing the load at initial phases. So what will happen? By increasing the this cement, it will go up, and now it will output the two packets, right? So your cardiac output is increased at the initial phases, but everyone has a certain limit. अब आपने क्या किया, उस मजदूर के ऊपर 3 सीमेंट की बोरी रख दी. So it has a some capacity. So now whether you think it will work efficiently, and push the blood to the aorta. जितना आपको 72 बीट्स पर मिनट चाहिए वो उतना कर पाएगा, वो भी 1 मिनट में मे बी वो 30 ही साइकिल पूरा करे. So it could result in heart failure due to this is the be called preload, right? This is the one condition. Second condition is now your preload is okay. There is no preload, is not increased preload. Preload is okay. Only one body of cement is there. Now what happened? Problem is here, where it has to be eject the blood. Here is the problem. Here is the obstructions. Now I told you एक बोरी वो लेके जा रहा है, एक बोरी उसको फेंकनी है, बट यहाँ पे कोई ऑब्स्ट्रक्शंस है, उसकी वजह से दैट वर्कर इज अनेबल टू पुश दैट पर्टिकुलर अमाउंट. सो वो उसका हाफ ही पुश कर पा रहा है, हाफ वो दोबारा लेके आ जा रहा है, फिर दोबारा लेके आ रहा है, फिर दोबारा जा रहा है, फिर दोबारा उसके सर पे और बढ़ रहा है. सो इट इज आफ्टर लोड. लोड किस पे? लोड ऑन दी हार्ट क्रिएटेड बाय कॉन्ट्रैक्टिंग वेंट्रिकल्स ड्यू टू रेजिस्टेंस इन द आर्टरीज. And what is preload? Preload is the load on the heart during the diastole when it's relaxing, right? Then suppose another conditions can happen like everything is okay, preload is fine, afterload is fine, everything is fine, but there is a problems with this worker health is not good. वो सही नहीं है, उसको फीवर आया हुआ है. तो do you think कि उसको फीवर आया हुआ है तो वो इसमें एफिशिएंटली काम कर पाएगा? It could result in heart failure. Right, so that is your intrinsic factors, and these are your extrinsic factors. So this is afterload, load on the contracting ventricle due to resistance, and load on the heart created by the blood during the diastole. So accordingly, we have to give the medicines. We have to decrease. How you can improve the condition of the heart? You can decrease the preload. जो आपने 3 बोरियां उसके सर पे रख दी तो उसको कम करो दवाई देके, तो वो एफिशिएंटली काम करें. जो यहाँ पे आपका ये रेजिस्टेंस है उसको आप डिक्रीज कीजिए. तो यू हैव टू डिक्रीज द आफ्टर लोड. इफ देर इज इंट्रिंसिक प्रॉब्लम यू हैव टू बी ट्रीट द इंट्रिंसिक एक्टिविटीज, राइट. सो दिस इज योर कंजेस्टिव हार्ट फेलियर. एंड व्हेन वी टॉक अबाउट सिम्टम ऑफ CHF, सो सिम्टम इज आई टोल्ड यू देर इज ए पल्मोनरी एडिमा. And pulmonary edema will happens due to left ventricle failure. How? So, as you know, this is your left ventricles. Left ventricle is pushing blood to the aorta and then the arteries. So if left ventricle is unable to push the blood further, so what will happen? So your back pressure will increase. So this is connected with lungs. So what will happen? Back pressures to this, then back pressure to aorta, then back pressures will be there. So if pressure is increased, so your hydrostatic pressure will also increase. So due to increase in hydrostatic pressures, what will happen? Your plasma or the contents of the blood going to leak out, and this fluid is going to accumulate in the lungs, and that will be called pulmonary edema, right? Now if your right ventricle will be failed, then what will happen? What symptoms? If this pump is failed, right? If suppose this pump is failed, then what will happen? Your all over the body edema will happen, because back pressure to your arteries, back pressure to aortas, and wherever your distribution is happening, so your fluid accumulation will happen. So all over the body edema will happen. But in left ventricles, your pulmonary edema will happen more. Got it? Then another condition is fatigue. Because your cardiac output is decreased. So cardiac output is decreased, so blood is unable to carry proper amount of oxygen, nutrients. So if your cell is not getting oxygen or nutrients, they are not generating the ATP, and by ATP you are getting the energy, so you will get the fatigue. So fatigue is another one. And for the diagnosis, of course, you have to do the ECG, right? So ECG, you all know there are different waves, P, Q, R, S, T. P represent your atrial depolarizations when your atria contract. QRS represent your ventricles is contracting, and T wave representing your repolarization when your heart is relaxing. So by ECG we will get to know where is the problem in the heart. That there is echocardiography is also there. There is a special blood parameter as well, specific parameters which are released when there is an injury to the cardiac cells, like troponin. Troponin is one, right? CKMB, CKMB, creatine kinase myoglobulin. That is another markers. By measuring the level of these marker, you will get to know that your cardiac health is not okay. There is something problem in the heart, because these particular protein will be released in the blood when there is a cardiac injury is there, right? So treatment, you know what treatment we have to give. You have to, as I said, we have a drug which will decrease the preload. We have a drug which will decrease the afterload, like diuretics. Diuretics we are giving to the CHF patients. So what are diuretics? Diuretics are those drugs which will increase the urine output. So by increasing the urine output, you will inhibit your compensatory mechanism. By compensatory mechanism, what's happening? Due to RAS activations, your sodium and water is reabsorbing. So now you are giving the diuretics which will increase the cardiac output, because you don't want to retain. Otherwise your preload will be increased, your afterload will be increased. So diuretics are most commonly used in the CHF. If you are still unable to manage the patients, we have these renin drugs as well, like already discussed, captopril, enalapril, which are blocking ACE. There is a ARB blocker as well, losartan, candesartan. But if still you are not able to manage the patients, so there is a one drug, popular drug in the CHF is digoxin. So digoxin is a drug. I told you there is a sodium potassium pump, or we will do in other lectures. There is a sodium potassium pump by which 3 sodium will go outside and 2 potassium will go inside. So this drug will inhibit this pump. So by inhibition of this pump, what will happen? Your sodium concentration inside the cell will increase. So increased concentration of sodium will result in more accumulation of calcium. More calcium will interact with actin and myosin filaments, and more contraction will happen. And what is your objective? What you need? You need your ventricles will contract and push the proper amount of the blood to the arteries. So digoxin is one of the most popular drug. But again, problem with digoxin is not a safer drug. It belongs to narrow therapeutic range, means if you are increasing or decreasing a little bit concentration, it will produce a toxicity as well. So digoxin we are not using as a first line therapy. It's a second line therapy when your earlier drugs are not able to manage it. Okay, so that's it. I think means treatment we will not focus much more. So thank you so much. That's it.